what habits or routines have been the most critical in sustaining you through, the ups and downs of practice? Like, have like a certain routine, the way you touch your day, the way for fire practice.
From my own experience, I think I gained the reputation over the years through my own NHS practice of being a thorough doctor. So obviously, I communicate with staff, I communicate with patients, and I write to patients based on the Royal College recommendations as well. So that had created an impression, and people I come across that I am systematic in my way, in the way I assess patients, and also because I'm quite a busy clinician and managing different aspects of cardiology patients, that gave me more exposure to seeing different variety of patients and do variety of procedures. So that's a personal, if you like, thing. In terms of advertising, obviously, I'm in the hospital website, advertise myself in terms of my skills, my experience, my qualifications. They may well be likely to be a factor, of course, because people may approach hospitals, websites, and look for doctors and read their profile. So that's another factor. So it's both the marketing aspects. That personally, I do myself, to be honest, because through private hospital registered. My own reputation, like word of mouth from people I see and experience and staff I communicate with and GPs, etc.
I wanted to ask, in your view, what separates a thriving power practice from one that struggles?
Okay, that's interesting. I mean, from my own practical experience, because as I said to you before, basically, my majority of patients I had seen before were insured patients because I ranked highly in some of the popular insurance companies, flow of patients through that. However, this is changeable because obviously your ranking and insurance company can change due to several factors. In my case, there was issues with the performance data that was unfortunately miscalculated and led to a drop in my ranking in some of the insurance companies. One particular insurance company, which is a dominating one, and that led to a drop in the flow of patients to my clinic. So obviously, then you look at other options in terms of how you can regain that by marketing yourself better for self-funded patients or other insurance companies, if you can obviously capture them, because they all have different system of recommending you as a clinician to their patients, which is not known to us. To be fair, I only come across it recently with this particular insurance company. So you can only compete with competitors through potentially marketing yourself, I guess, which I am.
Yeah, 100%. Agreed. And also, I want to ask, like, do you design your patient journey in a certain way?
Well, I mean, patients book directly, or the insurance company book for them directly. That's the first step. Then my secretary would book and gather as much information as possible. And they got booked into the clinic. I've got the option of either Zoom, telephone, or face to face. So that creates flexibility because some people have got far away, so they prefer virtual consultation. So that then take place, the consultation. As I said, from the feedback I get from patients, this is impacting on experience of patients where they usually leave happy from the clinic in my usual practice. I spend enough time with patients, explain to them, reassure them when they need reassurance, tests, potentially. And then normally we wait for the test to come back and then we organize a follow-up. We give the patients the option of face-to-face follow-up or virtual to discuss the test results. And then depending obviously whether they need future treatment, follow-up, etc., we could organize future follow-up depending on what the requirements are. If the tests are reassuring and they're happy with them, then they'll be discharged.
Yeah. Okay, nice. And I wanted to ask, obviously, a lot of people that follow me are interested in growing their private practice. What are the most common marketing mistakes you see a lot of other medical consultants making?
I think, to be fair, what has changed now is the patient has the power of choice at the moment. And we still have an element of that where you rely on your locality, being known to GPs or other professionals who have clinical contact. They may recommend you through the knowing you or experience. If they perceive you to be a good clinician, they may recommend patients. For example, I saw a patient yesterday who was a self-funding, and he mentioned a previous nurse who was working with us in the NHS. and she was his neighbor. So she said, I'd recommend you to see this doctor. So that's probably not a big number of people. And I think, I mean, I got the impression, honestly, I don't collect, maybe I should. I don't collect like they do in business where they collect information from patients, say, how did you hear about us? Or how did you get to come and see me? That kind of thing. And that would be more scientific to know exactly where the patient come from. But, like we all do, we search, we Google, for everything these days. So I suspect patients do the same, and you got to somehow attract patients that way, which I don't have at the moment by having a good website, being high in the search engine, all these things. I think that they are important. Although everyone is doing the same, so I guess it'll be a competitive world that way. So I think social media plus marketing, Google, ranking, all of these will probably help in addition to insurance company. Because I think the way it works also with the insurance company, from my own experience, they actually direct patients to clinicians based on their own criteria. Cost is a major factor from the insurance company point of view. So they will probably more likely to refer people to maybe a general, say, cardiologist like myself, as opposed to interventionists who are more likely to be costly in terms of intervention early. Because you always have the options of different way of treating patients potentially. I mean, there is medical management as opposed to interventional management, and at what stage you scale up to intervention, which may or may not be needed at that particular point. And that can be, to be fair, a factor, especially in the insurance companies, because obviously it would be a lot more expensive for them if they have too many intervention too early when patients may not need them necessarily. So there are a few things that you have to think about dealing with insurance patients, dealing with self-funding patients. Again, self-funding patients, depending what type of patients you're looking at. If you look at the wealthy, well-off patients, they may be fine to pay for everything. But some of them, they just come for clinical consultation and advice, and maybe seek a different route back to NHS through the GP. Some of them, they're willing to use their saving to pay for expensive interventions and stuff like that. So it is multiple factors, really. Yeah.
Yeah, 100%. When asking about AI, obviously that's a huge part of most people's lives moving forward, but I'm curious to know your thoughts on the medical side. How is technology, particularly AI, changing chiropractors today?
Yeah, AI. I mean, we use AI now with caution, obviously. And I mean, I use it mainly for looking for evidence, because some of the AI platforms, they're pretty good in collating data for a particular condition, and you want to know what's the evidence of more evidence-based treatment, for example. I use it for that. I think beyond that, it's just mainly I use it as an alternative search engine, which is more reliable. But I do check on it, because sometimes, depending on the question you ask, if you ask the wrong question, you get the wrong answer potentially. So you have to be careful about taking it at face value from that point. But in terms of how it works, I mean, I know in the NHS, it does pull data from multiple sources, and it can be powerful that way. But beyond that, in terms of, for example, in advertising, I honestly have no experience with that. Whether you could have software that capture certain things. I mean, it's similar to search engine, I guess. Because, for example, if you have keywords highlighted in your area of specialty, I tried that in my own profile, then you could come up higher depending on what actually keywords you put on your profile. If the patient search for symptoms, it's supposed to search for conditions. If you cover those with particular terms, then it may improve your ranking. People search for certain.
What are the biggest legal or regulatory pitfalls that new medical consultants often overlook when setting up their private practice?
Well, I mean, you normally have to have a substantive post. That's number one. I mean, I mean, so thinking about insurance company, for example, or private hospital, because unless you do it from your own home or your own clinic, there are certain rules and regulations. For example, I mean, you have to have a substantive post. You have to be in the specialist register potentially, and that's most both insurance companies and private hospitals require that potentially. So that's at work in the UK, as far as I know, at least in private hospitals. So that's important. You've got obviously have to follow the GMC guidance, whatever you do. So that's mainly it. I mean, I have to be careful about conflict of time if you're working in the NHS, for example, because, for example, I mean, there've been people who lost their jobs by foolishly doing private work when they're supposed to be their normal work and it's just job. So because that's contractual important. So you have to set time aside for private practice that doesn't conflict with your own NHS work, for example, and be detrimental to your current patient's care, because that's important. So these are the main ones at the moment. But I mean, it's pretty flexible. I think if you got the time and you could manage the time well, and dividing if you're mixed NHS and private, you could manage that. You could usually drop your NHS hours more private work. If you go fully private, I don't know really how it works with unless you set, I mean, you could set yourself up as a private company, I guess, without working in the NHS or without working in a private hospital. But you have to, there will be the extra cost of setting up a place to run it. It's quite expensive to have premises with CQC regulated, etc., which is not easy for individual consultant unless you've got enough investment.
If you're going to start over again your private medical practice, what would you do different?
Honestly, I don't think I would have done much differently because number one, when I started 2 or 3 years after starting my NHS job, which is a busy job. So I'm careful not to promote myself too much because I've got limited time. Plus, I've got family time. So you got to have to work according to your capacity, time, and energy, because you're human. And then you need a bit of rest. You need a family life, etc. So I don't think I would have done much differently. I think looking back, maybe I should have cut down this because I was really stressed out at some point, especially after COVID, where the private work gone up quite significantly, but the NHS work was quite busy as well. So it become quite stressful and managing everything at that time. So maybe in hindsight, I should have done that. Now I'm kind of less busy in private work, largely because of the insurance patients. But again, I have to plan cutting down on the NHS work. Otherwise, we'll go back to the same high workload, stress, which I don't want to have really. I mean, because I don't want to affect my health potentially.